It is now 10:31 a.m., November 7th, and we are here in the Senate chamber. And I now call this Health, Education, and Welfare Committee to order. Just to introduce the members of the committee who are present here this morning. To my far right, we have Senator Selena Babauta. To her left is the vice chair for the committee, Senator Karina Magofnia. I'm Donna Maloney, chair for Health, Education, and Welfare. And with three members present, we have a quorum to proceed with today's meeting. Senators Dennis and Frank are hereby excused, but I was informed that Senator Dennis will may be joining us shortly. All right, before we begin, can I get a motion for the adoption of today's agenda? Motion was made and seconded. All in favor, say aye. All opposed, say nay. Motion carries. We now move down to public comments, and I now open the floor for any member of the public to make their comments. Please state the name, your name, and the entity you may be representing. Thank you.
Hofedezan Ciro, Chair Manglonia, Senators, thank you for the opportunity to address you today. My name is Eleanor Cabrera, and I'll be providing comments on behalf of CHCC as the Chief Strategy Officer on Senate Bill 2367. At CHCC, it is our duty as a public provider, health safety net to ensure care is provided for all CNMI, regardless of the status of one's health insurance coverage and individual ability to pay. This necessitates CHCC to plan and prepare as best as possible for a higher demand for health services and real provider shortages. Given this reality, coupled with our geographic location, limited resources, and complex health needs, CHCC is in support of the bill's intent to enable the Healthcare Professions Licensing Board to be able to promulgate updated, more practical regulations according to their source law to effectuate the hiring of foreign trained physicians at CHCC and its affiliated facilities and clinics. Physician pools in the U.S. are an evolving landscape. While interest in medical school is still high post pandemic, there have been some challenges, for example, related to retention and completion, primarily due to such things as burnout, mental health issues, and changes in learning formats towards virtual platforms, for example. It has always been challenging to pique the interest of primary care and specialized providers to relocate and practice in the CNMI. So when we anticipate the pool getting shallower from the start, our concerns about physician shortages in the present and our future become greater. CHCC did request the legislature for special consideration of the special medical facility permit, and justifiably so. While CHCC navigates the expansion of primary care and specialty services, we are highly cognizant of recruitment and retention challenges being further exacerbated by financial constraints set by our cost reimbursement structure of service costs only, excuse me, cost reimbursement structure by CMS. With many of our patients being Medicaid patients, we are reimbursed at 83% of service cost only, unlike private providers. This alone puts CHCC at a distinct disadvantage from the get go. This also does not include our uncompensated care for under or uninsured patients served when times arise when CMS directs all Medicaid patients to CHCC instead of private clinics, and when the CNMI exceeds its federal Medicaid dollars or federal Medicaid cap and leaves CHCC vulnerable to non-payment, all of which further hinders our ability to offer competitive compensation packages to both U.S. and foreign licensed physicians. Thank you. Chair, may I also submit written comments provided by the Rhoda Health Center and the Tinian Health Center,
Yes.
as well as comments from our Population Health Division on Senate Bill 2354.
Yes. Thank you.
Thank you.
Thank you, Ms. Cabrera.
Good morning, Honorable Speaker and Senate members. I am here to support Senate Bill 2367. Excuse me. My name is Dr. Marty Rohringer. This morning I am wearing two hats. One as the Deputy Chief Medical Officer at CHCC, where I am involved with recruiting for doctors and other providers for CHC, Rhoda Health Center, and Tinian Health Center. And my other hat is as Vice Chairman of the Healthcare Professions Licensing Board. On that board, we vet doctors and providers for their qualifications and appropriateness for working in the Commonwealth. This is not only at CHCC, Rhoda Health Center, Tinian Health Center, but also for the private sector. Anyone practicing professionally as a doctor or other healthcare professional needs to be licensed through our board. I'm here to let you know that I'm sure you're already aware, but there is an increasing crisis across the nation, not only here. It's a nationwide issue where there is a shrinking number of primary care and acute care providers in remote areas. So this would include us in Saipan, but especially in Rhoda and Tinian. Trying to get an appointment with a primary care doctor is a challenge. I'm sure you've either had firsthand experience with that or know people who do. This problem is upon us already and is not expected to get any better. And we are we are required to explore other resources in finding qualified doctors. This problem is certainly in primary care already, but is expected to worsen in specialty care as well. At CHCC, we have leveraged multiple recruiting resources without adequate results, and I know the private sector struggles with this as well. I've had conversations with Mariana's Eyes CEO and medical director, Dave Coram, who are struggling with this issue with their institution. Medical schools in the United States are graduating insufficient numbers of doctors for the aging population, and this problem is expected to worsen. Historically, in the CNMI, we've had the unique opportunity to send our patients to healthcare facilities outside the United States, such as Philippines, Taiwan, Korea, and Japan for care. We know there are qualified people who can care for our people who are not trained in the United States. Our current regulation and laws are a barrier to bring qualified and excellent doctors to work here. I have absolute confidence that we have the resources to vet and ensure we bring in skilled and qualified doctors from foreign countries to address this immediate and critical need, especially for primary care in Saipan, Rhoda, Tinian, and the specialty care expected the lack of specialty care is expected and on our doorstep already. Thank you for consideration of this important bill. I appreciate your time.
Thank you, Dr. Rohringer.
Honorable Chairman and Senators, I'm here to support Senate Bill 2367. I'm Matthew Nelson, current Emergency Department Director and Chairman at CHCC. First, let me say it has been my humble pleasure to serve the CNMI community in CNMI community's emergency medicine needs for the past 5 years. The emergency department has traditionally provided supplemental medical services to Tinian and Rhoda. However, over the past few years, the emergency department and the family care clinic have found it increasingly difficult, as previously stated, to provide coverage to Rhoda and Tinian, as our departments are also facing recruitment and retention issues. While our emergency department providers are able to care for all ages, our training and focus is in emergency and urgent care, not primary or continuity care. As a first board certified family medicine, family physician, I cannot overstate the importance of access to preventive and consistent primary care. I strongly support the opportunity that foreign medical doctors would present in addressing the continuing health needs of Rhoda and Tinian. Thank you for your time.
Thank you, Mr. Nelson. If there's no one else, I'd like to also state for the record that we received comments from the Attorney General's office and from the chairman of the Healthcare Profession Licensing Board, Mr. Theodore Parker, in support of Senate Bill 2367. At this time, members, any discussion? But before we entertain any discussion from the members, I'd like to mention that the initial bill was focused on providing for the license to foreign physicians to practice within CHCC, but after receiving the comments from the Attorney General's office, Council had prepared a substitute, which I believe the Vice Chair will be introducing. And so at this time, I'll recognize the Vice Chair to go ahead and make that motion so that we can discuss the substitute version. And so at this time, Vice Chair, you're recognized.
Thank you, Chair, and good morning to everyone who are here in the chamber. At this time, I would like to offer a substitute to Senate Bill 23-67, specifically on Section 4, which was an amendment to Title 3, Division 2, Chapter 2. Article of the Commonwealth Code is hereby amended by inserting a new Section 2237, and the substitute will instead have subsection 20, an amendment to 3 CMC subsection 2214. So moved. Sorry, the subsection 2214 is the limited practice for physical physicians licensed to practice in a foreign country. So moved.
Mr. Chairman, before I offer a second to that motion, can I get the latest copy? I don't think I have it. This is what I have. Oh. I'm ready. I second the motion.
All right, thank you. Any further discussion? All in favor of adopting the substitute, say aye.
Aye.
All opposed, say nay. Motion carries. We now have Senate Bill 2367, Senate Substitute 1. We also have, thank you, Senator Mendiola, for joining us. Right now, members, we have the substitute in front of us. We do have the individuals from CHCC available to answer any questions that the members may have. And so at this time, would you like to call up any of the CHCC members to join us? Short recess. back into our committee meeting, and at this time, I recognize Senator Babalta.
Thank you, Mr. Chairman. Mr. Rohringer, you mentioned earlier in your public comments that you are here as a board member of the Medical Professional Licensing Board and also as a recruiter for the hospital for medical professionals to practice at CHCC. And so in the substitute, can we give him a copy just so he can follow along? Thank you, Senator Manjola. Dr. Rohringer, if you could turn your attention to page 2 of the substitute bill.
Yes.
Line 19.
Yes.
Okay, on line 19, it starts with practice in a foreign country other than Canada was stricken out. And I know you're a medical professional from Canada as well. Can you help us understand why Canada should be excluded?
It's not really excluded. It's just, I think, this current situation is the only country that the United States recognizes a residency from. A residency is after you do your medical school, you do your subspecialty training, emergency medicine or what have you. Canada is the only country that the U.S. recognizes that training. So that's why it's being removed mostly because it's redundant.
And it is
the li-
accepted by U.S.
Yes.
Professional licensing
Yes.
examiner.
All U.S. states accept Canadian residency training. They don't recognize any other country. So that's why it's not really excluding Canada. It's kind of redundant because we already have
So
regulations.
it's a reciprocal.
Yes, it's reciprocal.
Are United States medical professionals also able to practice in Canada without
Yes.
taking? Okay, so it's a
Yes.
reciprocal relationship.
Yeah.
As far as
So it's
medical
more of a
professionals.
redundancy than an exclusion because there's already regulations written for Canadians.
Okay, here in the CNOI.
Yes.
Okay, thank you, Dr. Rohringer. I yield, Chairman.
Thank you, Senator Babalta. Any other questions from the members? If there's nothing else for Dr. Rohringer, thank you, Dr. Rohringer, for joining us here in the chamber. Any further discussion from the members? Ready? All right. Yeah, with that, can I entertain any motion from the members? To file, to adopt, to recognize a vice chair.
Thank you, Mr. Chairman. I offer a motion to adopt Senate Bill number 23-67, Senate Substitute 1, so moved.
Second.
All right. The motion was made and seconded. Any further discussion on that motion?
Ready?
Ready? All in favor, say aye.
Aye.
All opposed, say nay. Motion carries. Senate Bill 2367 SS1 is hereby adopted. We now move down to the next item on the agenda. We have Senate Bill 2354 to regulate awful corbice, which is lime, under the Pure Food and Drug Control Act and for other purposes. As stated by Ms. Cabrera, we have comments from Mr. John Tagovall, the EHDP Administrator from Public Health Services. He provided some recommendations, but not something that would not something that is geared towards amending the current bill. Any further discussion from the members? Recognize the vice chair and author of the bill.
Thank you, Chairman. So just to give a little background on the premise of this legislation, it's really just to provide some protection to our consumers and also to the natural resources, which is what the core is what's being used to prepare the lime or the awfuk. And so currently at this time, there's no there's nothing in place that requires the manufacturers or producers of lime to get the product tested for, to ensure that it's safe to for consumers to ingest or consume. And I just wanted to put that protection in place. I know there are no hard evidence or studies linking Lyme to oral cancer, which is, prevalent here in the CNMI. But I wanted to at least start the process where the the OFIC itself is being tested to ensure that there are no foreign um, ingredients in there that might be harmful to, the people who are consuming the products. So that's pretty much the intent of this proposed legislation. So I'll be happy to take any questions if there are any, but really it's just to ensure that we put some standards in there as far as labeling, where they're being manufactured, who the companies are. I know that some of the OFUC right now, they do have labels on their ingredients and whatnot, but I want to take it a step further and get it tested, so that's the background to this legislation.
Thank you.
Thank you, Chair.
Thank you, Vice Chair. Any other members? I did want to point out that while the comments provided by Mr. Dragable stated that Public Law 1140 required food labeling, we do see labels on the off-book at the stores, but it doesn't contain. I think some of it doesn't contain what are the substances that are included or ingredients of the off-book other than just it being coral. But I also noticed that on Guam, the off-book is properly packaged with a seal, unlike here in the CNMI. And this is the same vendor that sends to both Saipan and CNMI and Guam. And so I think just requiring that extra packaging and security so that nothing else gets added in the process, it will provide for better safety standards. And so I support the intent of the legislation, and it just provides an extra safeguard for the consumers. Any other comments from the member? Recognize Senator Babalta.
Thank you, Mr. Chairman. I agree with your concern. I think that is addressed in page 3, line 13. However, I do, in looking at the cursory review of this bill, does it require to undergo the same sanitary process as they would a food handler? But I guess that is by regulation, it can be regulated that way. It doesn't necessarily have to be in the statute, but it would be prudent to include some kind of provision in there that, the sanitation division of CHCC would promulgate regulations related to the inspection, not only the inspection of the product itself, but the handlers of this and also the location or wherever they're processing this. I think for sanitary reasons, it would be prudent to do that, but I don't see it incorporated into the bill. So that's just my recommendation. And I hope it is included.
Thank you. Thank you, Senator Babalta. According to Mr. Tagoville, promulgated within Public Law 11-40, Article 2, Section 203, food labeling is required and is adhered to by vendor or distributor before food or drink sanitary permit is granted for normal operation.
Thank you, Mr. Chairman. That addresses my concern.
Thank you. Senator Mendiola is recognized.
So bottom line, thank you, Mr. Chair. So bottom line, this is pretty much to just add that added layer of security or protection in terms of regulating it and packaging and including the ingredients that's included in our food, pretty much, right?
Yeah.
So, thank you.
Thank
I
you.
just wanted.
Yeah, I think because there are some concerns from the community. They are speculating or um, making false claims that they may have included white cement. But according to Mr. Tagawa, also that they've investigated and found no traces of such, and so it's just adding that extra layer to ensure that no extra substances are added other than what would be included in the labeling. Recognized, Vice Chair.
Thank you, Chair. And again, also going back to Mr. Tagovell, right? He did state under his current findings, if you look at number 5, or yeah, so the CHCC team has interviewed off a production owner of basic of processing lime. However, at this stage, the processes conveyed are sketchy at best to meet minimum sanitary standards, and that again is very concerning, you know. And so I just wanted to put that extra layer in there, and also for the consumers who are purchasing these items and consuming them, similarly to any like the cigarettes or any other like alcohol, right? Like there is that warning that tells them what, you know, what they are purchasing and consuming. So this is also to put onus on the consumers who are purchasing the product to at least advise or give awareness that, you know, you may be consuming something that is not tested, you know, it hasn't passed like FDA and stuff like that. So again, just putting awareness on the consumers and putting that onus on them as well. So that's all. Thank you, Chair.
Thank you. Any other members? Okay. And it'll be helpful to see what's in that packaging because some use water, some use like a milk substance to make it creamy. So, yeah, the safeguards that is proposed in this legislation would provide for the general public a better understanding of what's included. Recognize Senator Mendiola.
And I'm just kind of curious too on the like the shelf life, I guess, on this. Like, does it just sit there? You know, is it? And then we were just talking about, or you mentioned something about Guam and the way they sell this product, where they have this seal, they have it sealed, right? So one of the things that's concerning too is that it just sits on the shelf, right? And anybody can just come here and tamper, or come in there and tamper with the product, and nobody will take any fault to the issue. So I guess this bill does make sense for us to add that added layer of security or safety for our consumers. So I do agree with this. Yeah.
With that, Senator Manila, I think maybe a recommendation to include as part of the packaging or the label is the production date. I don't know if that's something that you guys want to consider. I don't know to what effect lime goes bad, even
Should
when
we
you
put it-
add liquid to harden or to make it more of a paste-like substance. What effect that would have? But it's just something to consider as part of the amendment. Sorry, members. At this time, I would like to invite any members of the public that would like to provide their input.
Thank you, Chairman. Members, I'm John Daigo.
Sorry, sir. Yes, thank you.
Thank you, Chairman and members. I'm the writer of that comments there. There's few gaps that we're still looking at how we could strengthen our. I agree with you guys to regulate it, but there is a cross-sectional responsibility with Lime itself. Division of Finance oversees the bitternut, and the source for the lime comes from is authorized by Fish and Wildlife or DLNR. I met with them last week, and they still have to iron out, especially from Luta, Suffolk. And I've communicated well. I've sent an email to my colleagues in the Pacific because the four Suffolk that we have, three of them comes in from Palau, Yap, and the fourth one is we're unsure yet. So those are the things that, but like the senator mentioned, there's a lot of sketchy processes that we need to end on. We haven't permitted, we haven't looked at it just because what ABCT was the one that was regulating the beer nut. So I'm open for your comments if there's any misunderstanding. But as far as our regulation is concerned, 11-40 regulates food, but then 12-48 give us the processes of inspection and stuff like that.
I recognize the vice chair.
Thank you, Chair, and thank you, Mr. Tagoville, for providing comments. So, can you help me understand then, like when we import the offuk from the others micronesian states, how do we test for the ingredients to ensure that they are truly lime from the coral, or like how do we protect? Basically, the premise of this is to protect the consumers, right? And so, how are we doing that? What types of testing are we doing to ensure that the ingredients that are being claimed, because some of them I've seen that just come in a container or like one of those things that you squeeze like an ointment thing, and there are no ingredients, but they're being sold to our people, and so I just again, going back to safety, right, for our consumers, how do we regulate that and test to ensure that they are indeed safe for consumption?
So the fact is, we haven't regulate. We don't have them on our radar. But I'm starting to make contact with FDA to see if we could test those limes, representative limes in the retail stores.
Yes.
Until then, I cannot give you a definite answer on it. What I could give you is what I have seen or what we have investigated, and the rumor about lime mixing with cement. I'm mature myself, so put it out there. So when you go down to the bottom of the canister, the container for the lime, there are times that it bitters. It bites. I mean, it burns your mouth basically. But what's inside, I'm not sure. Okay, I know it's lime, but whether it's mixed, until we have a definite answer from the lab. I've contacted FDA for the chemistry lab in Guam, whether they could assist us. So that's still pending.
Okay, so I guess my next question would be then, if we are not sure of the content or how safe the ingredients are in those products that are being sold to our consumers, should we continue to allow those products to be sold until we figure out what those are? Or, I mean, is there a need to be, should we be concerned that we are, because right now anything that's in the store pretty much are required to have labels, right, and the ingredients, and most of them, I think the part of the requirement is also to be in English, which I'm pretty sure we're not really enforcing in some of the stores. But for specifically for lime, I don't want to go into other things, but specifically for lime, do we need to be concerned about putting selling products out there that we really don't know how it's made and what ingredients are being put into that product and being sold out there? I mean, I know this is not a popular question, and I'm pretty sure the Beetle Nut Chores are going to be probably upset with me asking, but I'm really just thinking about their safety and making sure that what they are consuming is indeed okay. And at the end of the day, it's their discretion and their decision to make, right? But I just feel like, we have a responsibility to our consumers to ensure that what, the stores that are selling are indeed, somewhat safe. I mean, even cigarette is not, but at least there's warning on the cigarette packets, right? In this instance, anybody can print out a label and just slap it on the product, but are they really being tested, especially because they are being ingested? So probably
Um, Congresswoman, professionally, I'll agree with you. I'm concerned too. But traditionally,
right.
I'm biased. So I'll just reserve that.
So yes, I totally understand. Um,
But we're taking action to make it right.
okay.
But back then, we never did test
Sure.
it or regulate it for that matter.
I know, and this was never an issue or concern in the past, right? Because we really, the people who were making it were it's our people making it, so we have that trust and confidence that the ones who are making it are, would never do anything to harm our people. But now we have outside people also making it, to do business, right? And so we just need to be a little bit more mindful about what we are selling to our people and whether or not it's safe. So I completely understand your bias, and I respect the culture and the traditions that our people practice. But I think it's also important that we look out for their safety and wellness. So I don't have any other questions, Chair, but thank you.
Vice Chair. I recognize Senator Mendiola.
No, so I just wanted to respond on in terms of like suspending the sales. I don't think we need to go through that extreme. At this point, if there was an outcry, I think we'd know by now that there's issues on the off book. So most chewers know whether it's off book that they're chewing or not. I chew myself, so you can tell whether it's off book or not. So I don't think we need to go through that extreme. However, we do have this bill. We do have this bill to actually push that added layer of security, and I think we need to just push this forward and start working with the professionals to make sure that these layers or these levels of improvement in terms of the security and the safety of our consumers is it's addressed. So I think, Mr. Chair, I don't have any other question. I think we should just push this forward.
Thank you,
Thank you.
Senator Mendiola. Mr. Tagabo, do you know if the lime that are imported is imported in bulk and then repackaged here in the CNMI, or are they already imported containerized?
So, Mr. Chair, out of the four labels that we've seen in the market, one imported powder-like and then repackaged it
Here in the CNMI?
here in CNMI, on Saipan in particular.
Just one of the
Yeah,
those
one of
imported?
the importer that we interview.
Okay. But do you know if the others are packaged in whatever state they're coming in from?
They package it, they label it, however, and it's a minimal label. Once we start regulating it, it will indicate when they package it, what's the ingredient inside, and where is it coming from. Not only the local contact, but where is the island or source of
Right.
the offal.
Okay. I think that goes to the vice chair's point in that at least for the products that are produced here in the CNMI, we have better control because our investigators can easily go in and see how the process is being done. But when we're importing these powder-like substance from elsewhere, we have no control over their requirements for safety and what else gets put into the processing of lime. And so I think the packaging part, I'm not sure what safeguards are in place at the border in terms of what's being imported that would be safe? Whether customs is also testing these powder-like substance for other, you know, um, substances are added into it or not. I think that's something that we can also work with customs and biosecurity to see if they also do the testing. Is that something that you're aware of? If they also test these substances at the border, if they may include foreign substances?
I'm not aware that they're taking any tests at the border, our borders. However, I believe they are aware because the import of Biranad, they will really scrutinize that too.
Okay. All right. Anything else for Mr. Taggable from any of the members here? Senator Mendola.
Mr. Taiwo, I just wanted, since we're talking about repackaging, I just wanted to know if there's any, like, let's say stores bring in products and then they repackage themselves. Do you guys regulate that? If they unseal whatever, let's say I give you an example, a sack of rice, right? The 50-pound, but they want to break it down into, let's say, 1 pound. Do you guys regulate that?
Yes, we do. And like pharmaceutical, if it comes in bulk, and the individual packets have to be labeled also.
Okay.
So that tells if they're on the shelf and they're not labeled, they're not meant to be separated.
Okay.
Whereas rice, we know that we look at rice, if they repackage it, we look at whether they have a permit, and normally they'll have a permit in the back.
Okay, and I'm just trying to tie that with repackaging, right? Because you were talking about, the offal getting imported and then it gets packaged here and then it's sold. So I was just wondering if there's some kind of mitigation to your office in terms of how these packaging are to be done, and if there's some criteria that are required to have just to to handle that. And so thank you for that.
Recognize Vice Chair.
Just quick clarification, Mr. Tagawa. So when, let's say, the offlooks that are being imported here, are the packaging requirements similar to like food packaging, where the sanitation goes and inspect the facility or the establishment that the products are being packaged, and then issuing the permit that they pass inspection? Is that similar to offlook, or?
So it's like those importers, we call them importers in our term. So those that import, normally they'll store it at their house. Their house have to be inspected. Anyone that it comes in contact with that, those are the moving parts that we don't know yet. Because you take a coral, you take it home or whatever place, and then you burn it, then you grind it. So we need to look at all those steps and processes, how it goes about, and who make contact with them, that particular substance. Or once it become a substance, that's where food handlers, you folks mentioned it earlier, everyone is required for that at that point.
Do we know how many vendors we have on island at this time, as to the ones that prepare the offlook, whether they package it or they make it themselves?
So right now we only know of one that we have interviewed last week, that they brought in the powder like and then they repackage it.
Okay, so then maybe if others were doing it, we wouldn't know, because they're probably not registered business owners.
Well, now we know the contact numbers are there. It's just a matter of tracking them down. Where do they place them before they
Right.
distribute it to the retail outlets?
Okay. Thank you for that, Mr. Tagoba.
Thank you, Vice Chair. One more question, Mr. Tagwell. Do you know, based on experience or maybe even expertise, if adding additional substances to the lime, would that affect the I don't know how you would say it, but like adding, for example, water, and in some cases people add I think carnation milk or some kind of milk. Would that change the
Composition of the
well, not so much composition, but that would that cause for it to become bad later on? And so, would that be a concern? Because I know in the States, the ones that they sell in the States is placed in a bag with water and whatever, and then it's placed in a container, and so you would have to cut off that water or cut off the back package to let it all out. And so at least it's contained within that packaging, that sealed packaging, when they add in something like water. And so I'm wondering if the way we do it now, where they just mix it already and then put it in a container that you can open and close, does adding these extra ingredients affect the shelf life of offal?
Sir, I don't have a definite answer for you. I'm just going by what they passed down, that you could add water or you could mix it powder like.
Okay, thank you. No, it just came to mind because I remember during college, these stores where they sell it, it comes in a vacuum sealed package with the water and the powder, and so yeah, based on off of experience. Anything else for Mr. Tagu? Recognize
Yes.
Senator Balta.
Thank you, Mr. Chairman. Just out of curiosity, I'm not a chewer, so that's why I'm asking the consumers, the experts. What does the effect have of adding milk? Because you would think that milk spoils as it ferments, so it would affect the potency and the quality of the pure offal. Can I hear from? I'm just wondering.
I don't use it, and
I
I
see.
have I don't use milk. Normally, I use the water on my part.
I remember when I
can-
used to too. I remember someone saying that it lessens or
Yeah.
it lessens the burn.
The burn, yeah. So it kind of gives it that less of protection.
Yeah.
So
But
like you
I
can put a
guess
lot more and not be.
they consume it quick enough to where it won't get.
But in terms of how long it's gonna last, I don't know, because normally you consume
It's
it
done
before
by the
it's-
time
Yes.
it'll probably ferment. I
That
don't
one
know.
makes sense because milk has an enzyme that protects,
And it's a matter of taste, maybe. I don't know. It's
Okay, I was just curious. Thank you.
Thank you. Thank you, Mr. Tagu.
But thank you. I will add that to the list when I ask the FDA lab to whether water, milk, or any other substance will make the chemistry different of that.
If
life.
that's something that I think your office is really looking at going into in terms of testing and seeing what resources you need, please feel free to reach out to the legislature to see how we can assist in trying to get those data and testing done so that we can, further strengthen the regulations or the statutes that are, in place, or the ones that we're acting on right now. And so whether it be a financial matter that we can address through additional funds or something like that, please feel free to reach out and see how we can assist in that regard. Recognize Vice Chair.
Thank you, Chair. And just one last final comment and recommendation, if I may. I highly, highly encourage for your department to push for the testing, especially because in today's society, right, we are plagued with drugs, like hard drugs, specifically meth and now fentanyl, and those types of drugs can be broken down into powder-like substances, right, which could easily be mixed in with the offal, and with our young children also practicing, the chewing of the betel nut. It just really, really concerns me, and I want to make sure that if they are going to practice the culture and and tradition of chewing betel nut, we could at least feel somewhat assured that the lime that they are using does not contain any of those substances. So I highly, highly push for that for the testing of the ingredients, and then the packaging for sure, to ensure that there's no tampering by the time it reaches the store and the consumers purchase it. So that's all.
So basically, what will happen is when FDA give us the green light to send our samples, we send samples. However, when there is big concern about offer in particular places or particular vendor, we'll collect samples and resend it again.
Okay.
And FDA has been very welcoming to try to help us out in our jurisdiction.
Thank you. That's all I have, Chair. Are you?
Thank you. Anything from the members? If there's nothing else, we thank you for your time, Mr. Tagalwal, for making yourself available. Any further discussion from the members? If not, I would like to entertain any motion from any of the members here. Recognize the Vice Chair.
Thank you, Chair. If I may, and no objections from the members, I would like to offer a motion to adopt Senate Bill number 23-54. So moved.
Second.
All right, there was a motion made and it was seconded. Any further discussion from the members? If there's none, all in favor of adopting Senate Bill 2354, say aye.
Aye.
All opposed, say nay. Motion carries. Senate Bill 2354 is hereby adopted. All right, with that, members, we moved on to miscellaneous. Does any member have any? Sorry, before we move on to miscellaneous, at this time, I would like to ask the LA to prepare the committee report for these two legislations that we adopted today to hopefully meet the next Senate session. Thank you. Anything under miscellaneous, members? Recognize Vice Chair.
Thank you, Chairman. Just a brief announcement. There is no tentative date for the joint session between the House and the Senate to approve the Suaso lease for Coral Ocean Resort, but I anticipate that the presiding officers will be calling one soon. So just to kind of give a heads up to the members that when that meeting is scheduled, I would really appreciate the support of the passage of the Suaso lease. Thank you, Chair.
Thank you, Vice Chair. In the meantime, I think maybe members can be shared copies of the draft so that they can start reviewing what was discussed in the committee for later discussions during the session. Anything else from any of the members? If there's none, can I get a motion for adjournment?
So move.
All right, motion was made and seconded. All in favor, say aye.
Aye.
All opposed, say nay. Meeting is hereby adjourned at 11:26 a.m.